Hello everyone, welcome to Seasoned and Smart. My name is Marge DiVirgilio, and today we have a great program. I know I always say that, but this is a very informative program, so pay attention. I'd love to introduce our guest today is Dr. Sanford Levy, I think I said that correctly, neurologist and director of the North Shore Medical Center Stroke Program, and Wendy Way Cohen, BSN MA Nurse Stroke Program Coordinator at North Shore Medical Center. Hello, folks. We're going to talk about, it is May is Stroke Awareness Month, so that's the big focus. We want to add that in. We want to make sure that we touch the points today. We're going to be focusing on understanding stroke and the importance of acting quickly on symptoms when somebody has symptoms. So, Dr. Levy, give us a little background on what stroke is.
The stroke refers to an injury to brain tissue related to interruption of blood flow or excessive blood flow. So you can have too much blood in the sense that you get a hemorrhage into brain tissue, or not enough blood, in which point you have what we call an ischemic stroke. There are varieties of different hemorrhagic strokes and different ischemic strokes, but nevertheless, that's grouped under one topic when people talk about stroke.
I think what we need to do is probably talk about the cause of stroke.
Well, again, different kinds of stroke, there are different causes. With hemorrhagic strokes, the two most common causes are hypertension and a congenital problem known as an aneurysm. Aneurysms are quite rare, although everybody's heard of them and they're worried about them, but they are very uncommon. Hemorrhagic strokes related to hypertension are a bit more common, but still not the majority of strokes that we see. The majority of strokes that we see are called ischemic strokes, which are caused by an interruption of blood flow. Again, those are subdivided into embolic strokes, in which there is a blood clot that comes from another part of the body and lodges in the brain. There are thrombotic strokes, which are caused by occlusions of the blood vessel in the brain itself, and a type of stroke called a lacunar stroke, which is a very small stroke but usually related to hypertension and diabetes.
Is that, when you said that lacunar stroke, is that something like a TIA when someone talks about a TIA?
No. TIA is a transient episode of neurological function loss related to loss of blood flow but without any tissue damage. So a lacunar stroke, while it may be small in size, depending on its location, can be rather devastating, but yet it is not transient. It is long-lasting symptom.
It's difficult. We want to understand all these things, but I think the important thing is the emphasis is on calling 911 and getting to the emergency room as quickly as possible. That we all agree on.
Yes.
Absolutely.
The importance also is getting a quick diagnosis. Wendy, tell us about, you're saying that North Shore Medical Center, they're the primary stroke hospitals in this area, both Union and Salem Hospital, correct?
Correct.
Yep. Why is that important? Tell us.
That's very important, Marge, because the State Department of Public Health has recognized us for giving stroke care, that we get the patients in quickly, we evaluate them quickly and get them the treatment needed. And we also measure our results of our interventions for these patient population.
So the minute a patient comes in, they're treated immediately, triaged.
Correct. As long as they come in within 2 hours of onset of symptoms, that's the very important thing.
Well, that's very important.
And that's what we want to focus on, is recognition of the symptoms, which can be weakness of face or one side of the body, confusion, trouble speaking, trouble seeing, sudden severe headache with no known cause, or trouble walking or loss of balance. So you don't need all of those symptoms, just one of those symptoms. You need to be evaluated right away, because we can intervene, but only if you come in quickly.
And I think that's the key, that we all agree to come in quickly, because like you just said, it's only one of those symptoms.
Right.
If you have one of those symptoms, you should be going to the emergency room instead of saying, well, maybe it'll go away.
We frequently
Because
hear
you know
that,
how people
Marge.
do that, sure.
That people go to bed, they hope that it's going to get better, but that's exactly what they should not do.
Right, right. I think we're going to have a video. We're going to show a video, which should be coming on shortly. I think it's about ready, so we'll kind of wait for that and see what happens. We will come back after the video and have some more discussion.
Jenny and her grandma May on an ordinary day. When there in the kitchen, Grandma started to sway. Grandma sounded strange when she spoke, and Jenny had to ask, what if my grandma's having a stroke? I think I better act fast. I think I better act fast. Does her face look a little bit uneven? Does one arm drift down? Is her speech coming out kind of strangely? Then it's time to call 911. Jack and his favorite friends were having lunch in town. When Hank looked up, half his face drooped down. Hank wasn't making a joke, and so Jack had to ask, what if my buddy's having a stroke? I think I better act fast. I think I better act fast. Does his face look a little bit uneven? Does one arm drift down? Is his speech coming out kind of strangely? Then it's time to call 911. Helen and Bob were walking at their favorite time of day. Helen turned to Bob and said, my arm is not okay. Her arm was limp inside her coat, and so Bob had to ask, what if Helen is having a stroke? I think I better act fast. I think I better act fast. Does her face look a little bit uneven? Does one arm drift down? Is his speech coming out kind of strangely? Then it's time to call 911. Stroke can happen anywhere, morning, noon, or night. And every minute after that, more brain cells die. Our heroes acted quickly, and so they all have hope. Precious time and emergency care, you can beat a stroke. You can beat a stroke. Call fast for any sign of stroke. It's what you gotta do. Call fast, call 911. The one you love is depending on you. Someone's 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 depending on you.
We're back, folks. That was a good little cartoon, and it's a good because it's a F-A-C-E, F-A-S-T, fast.
Face, arm, speech, and tongue.
There it is, yeah. So that's a wonderful thing to remember. Everybody can remember that except me, who said it incorrectly
It's
the
okay.
first time. Once someone is diagnosed, what treatments are available? I heard about a drug, a clot-busting drug.
Right.
Tell us.
If somebody gets to the hospital within the time limit that we have, and they're diagnosed as having an ischemic stroke, that's a stroke that's caused by not getting enough blood. We administer a drug called TPA, or tissue plasminogen activator. which we hope will break down the clot and allow blood flow to go to the area that is surviving, the area of the brain that's surviving. That's quite effective. Generally, the statistics show that people that get TPA will do better after a 3-month rehabilitation than those people who don't get TPA. But we've seen numerous people who've gotten better as the drug is infusing into the patient. If the drug doesn't work, or if the patient still has the symptom, he or she is admitted to the hospital, and the primary goal at that point is to support the patient so that complications from the stroke don't occur, and trying to do an evaluation to find out what caused the stroke so that we can treat the patient to prevent the next one. There's little question that people who have a stroke are at a much greater risk of having a second stroke unless some change is made in their treatment, lifestyle, or whatever else we have to do.
That's a big, lifestyle was a big word to say. People should listen to that. What kind of lifestyle changes could people make?
Well, first of all, we have to talk about what are the risks of stroke. The lifestyle changes that risk stroke are excessive weight, smoking, excessive alcohol, use of drugs. For the most part, those are the things that are lifestyle changes. Patients who are hypertensive or diabetic or have high cholesterol levels need to be treated for those. And then there are people who have very strong family history of stroke who have certain genetic abnormalities that can be ferreted out and treated before they become a problem, or before they become a problem again. That's more common in young people that have strokes.
That's interesting. So, dissolve the clot causing a stroke, that's what we just talked about. We talked about that medication. So we can see the importance of someone getting to the emergency room as quickly as possible, within 2 hours.
Correct.
A buildup of fatty substances along an artery, along the artery's inner lining, causes it to narrow and reduce the elasticity. This can lead to a break or a blockage, correct?
That's correct.
Yep. That means the brain cells are at risk.
Correct. Without blood flow.
No wonder a stroke can cause so much damage, and we want to prevent it. So we talked a little bit about what are the symptoms. So you're going to talk about weakness, numbness.
Weakness on one side of the face or body, confusion or trouble speaking or understanding, trouble seeing, trouble walking or with balance, or severe headache with no known cause. Those are those things that people need to be aware of and call 911 and come in quickly, because we have a very short time
for
the clot busting drug.
Yep. So sometimes I've got a couple of things here, like the blurry, dimming vision. I mean, someone can say, oh, well, maybe just my glasses aren't right, but they have to pay attention to that.
Correct.
And the dizziness or the falling, any falling that occurs, and a loss of balance. I just wanted to include those in so people can hear it again. And the severe or unusual headache.
That's correct.
That's, yep. And difficulty speaking.
Yes. Yep.
Not only not understanding, but the difficulty in speaking.
Either producing the words or having the speech slurred. Either of those is worrisome.
I think we were going to have a video here.
We've created this video to show you what happens in the ideal situation where stroke symptoms are recognized very early on and emergency medical care is begun. For Bob, as you're seeing in the picture, it was a regular day at the office. He was meeting with a coworker, but his coworker got concerned about halfway through the meeting that something was going on with Bob. He thought his speech wasn't quite right. To clarify this, he asked Bob to repeat the sentence, "The sky is blue in Boston." Bob was unable to do so, so his coworker knew he needed to jump into action and call 911 to get Bob help immediately. The coworker called 911 and explained how his coworker had started with the slurred speech symptoms around 10 a.m. and needed to be taken to the hospital immediately. Emergency medical services of the Lynn Fire Department arrived quickly on scene and loaded him into the ambulance. The Lynn Fire Department and the other ambulance services around the area work closely with North Shore Medical Center, both the Salem campus and Union campus, to best care for our stroke patients. While in the ambulance, Bob had an IV started, his heart monitored, oxygen applied, and most importantly, the paramedics from Lynn called into the experienced stroke team at the Salem Hospital of the North Shore Medical Center. At Salem Hospital, the staff were planning for Bob's arrival. The lab was preparing to analyze the bloods that the paramedics had drawn. CAT scan was getting ready to do a study for Bob, and the neurologist on call and stroke team were beginning to assemble. Here you see the paramedic speaking with the charge nurse to let them know Bob's story. To respond quickly, EMS is taking Bob directly to the CAT scanner and answering questions for radiology to quickly get that scan done. A CAT scan is needed of the brain to determine what kind of stroke, if any, Bob is having, because the treatment is going to vary depending on the type of stroke. It's only been a few minutes since Bob arrived at the door, but already he is being set up for a CAT scan to get his stroke treated quickly. It's important to position Bob just right to make sure that the CAT scan is accurate. Here you see the radiology technician using light beams to center Bob's head in the CAT scan to get that accurate picture. While Bob is in the CAT scan, the paramedic shares the information he has gained with the nurse caring for Bob. Fortunately, Bob was recognized to be having a stroke right away and got to the emergency room. He's been treated and back home.
Well, I'm glad that Bob made it on that video. That was interesting. And let's talk a little bit about, you were going to tell us something, Doctor.
Yes, as you saw in the video, when Bob called 911, the EMTs came and rapidly brought him to the hospital. It's not uncommon for us to hear from a patient, you know, my son wanted me to call 911, but I didn't want him. I thought I could get there faster by car. And you may be, in fact, be able to get to the hospital faster by car, but the EMTs serve a purpose in that they can support you, they get information about what's wrong with you before you get to the hospital, they get you there quickly, and they bypass all the administrative things that happen when you get to the emergency room. Nobody's going to ask you about your insurance, nobody's going to sit there and talk to you about where you live and what your birthday is. They're going to get you in, get you treated, get you evaluated first, get you treated, and get it done very quickly. And then worry about the administrative things. If you do it by car, they worry about the administrative things first. So it's clearly better to come by ambulance, and there are wonderful studies that show the treatment often takes place much quicker when you get there by 911.
May I also add that what happens, as we saw in the video, is that the paramedics actually call the emergency room, and we're able to prepare for the patient before they even get to our doors. So everybody's waiting for them.
Very important.
To act quickly so we can assess the patient to see if they can get that clot busting drug, because not everybody can, unfortunately.
Right. Tell us a little bit about both of you. How long have you been working together?
I don't remember.
It's a long. Oh, that's great, doctor. That was perfect.
It's been a long time.
How many years?
At least 20 years.
Wow.
Right. Wendy started at the hospital as a neurosurgical nurse 20 years ago.
Yep.
And then left for a while, came back as our stroke coordinator, and I don't remember when that was.
2005.
Okay.
I was, yeah.
So it's been 6 years.
Isn't that wonderful? Tell
Yeah.
us some of the stories. I know there's plenty of stories. Tell us about one you don't forget, that someone may have been in bad shape and came through. And
I had a patient who was a retired physician who came into the emergency room, and I was at the movies. So I left my wife and other people at the movies, came to the hospital, and this gentleman, very prominent physician, but had not been in medicine for probably 15 years, so he wasn't aware of some of the newer things that came up. So I was talking to him and I said, we need to give you this medicine. It's relatively new. There are some risks. And he said, shut up and give it to me.
good.
And so we did. And as it was coming in, as the fluids were going into his vein, he started to move better and made a wonderful recovery, following which the next day I had phone calls from people all over the country.
Oh boy.
Not
wasn't
a
that
position
great?
I would have, but it was wonderful.
Isn't it just wonderful?
Lovely couple, lovely people.
Wonderful.
You know, those are the kinds of things that make this very rewarding. It's very difficult for all of the neurologists and the emergency room doctors because you're dealing with a critical situation. A lot of us have to come in, you know, 2 o'clock, 3 o'clock in the morning.
Right.
But those are the kinds of things that make it worthwhile.
Of course. How about you, Wendy? You got something that sticks out in your mind? That
Well, I would have to say that we have patients that are very young too, that unexpectedly have stroke that we've successfully treated. So that's especially rewarding, as well as anybody that gets better is a great thing.
How about drugs? Do drugs play a big factor in the younger generation that you see coming in with maybe strokes? Or
Not necessarily the younger generation.
Ah.
We see some people who are middle-aged who use drugs that they shouldn't use. Cocaine in particular is a nasty drug in terms of strokes. Alcohol plays a big role. It raises your stroke risk at certain quantities. As I mentioned before, lifestyle is critical. And regular visits to your doctor at certain ages is important. People tend to ignore things that don't hurt. So if your cholesterol goes up, it doesn't hurt. You still have to do something about it. You can't tell when your blood pressure is elevated. So those are things, probably high blood pressure, high cholesterol, diabetes, and smoking are probably the major risk factors I think that we see in the general population.
I'm glad we brought up about the drugs and the alcohol, because I think a lot of times people want to just put that away because it's stuff that gives them pleasure, and they don't want to talk about that. And we need to talk about that more. I really do.
Alcohol in moderate use is good for you, but excessive use causes serious problems.
Absolutely. As does the drugs anyhow.
Right.
Small or large quantity or doses, whatever. Anything to add from either one of you? No?
I think there's some wonderful, if people are comfortable with the web, I think there's some wonderful websites out there that you can get more information about stroke, because there are different types of stroke and different treatment modalities. I think sometimes it might be a little easier if people are comfortable with that.
Good.
And I believe that we have a graphic on that. AmericanHeart.org is the American Heart Association, and there's wonderful information for patients and families there, as well as the Massachusetts Department of Public Health has done extensive work around stroke and stroke education for the public. They're the ones that produced that FAST video, and they can be found at maclearinghouse.com. And the information is free there and very helpful.
Well, I think that's great because, like you say, mostly, I'm not going to say most elders have computers because I don't think they do. But family members that have computers can go on those websites and get a lot of good information. I think the really important thing too is to encourage all folks to go to the doctors regularly on a regular basis. I really do. I mean, I know there's people out there, and I know them, I've met them, that no, I don't have a doctor, I don't go to the doctor. I think that's insanity, I really do. Especially in this day and age where there are so many, look at that drug, the doctor came in and you gave him the drug and it was like a miracle. I mean, it's, those kind of things can happen. So make people aware, and that's what we did here today. And thank you both very much. Thank you, Doctor. Thank you, Wendy.
Thank you, Mark.
Hopefully the beat goes on.